Hello and welcome to the Whole Body Therapist. My name is Jaspreet Randhawa and I'm a somatic therapist and clinical prescribing pharmacist. Today we'll be working with our suppressed anger and emotions with this 15-minute somatic exercise video. I hope you enjoy the video and use it as a daily practice for the next 30 days. But I just want to point out that any somatic exercises where we are trying to unlock emotions and energy can result in some discomfort and a surfacing of emotions that we didn't even know we had. Being in some level of discomfort from these exercises is absolutely fine and expected, both emotionally and physically. If this happens, please try to push through to your limits safely. If, however, you become very agitated to the point of great discomfort and this is extremely overwhelming, please stop the exercise. Lay down flat on the ground if accessible to you, breathe in through the nose and out through the nose, and this will be with the aim to ground you and take you back to a level of comfort. You may or may not have some releases of emotions, and either is just fine. Trusting in the process, trusting your body, enjoy your somatic exercises for suppressed anger. Coming into a comfortable seated position, taking a breath in through the nose and out through the mouth, we begin the Sufi grind. Inhaling forward, opening the chest and poking the chin forward. Exhaling backwards, rounding the spine and tucking the chin. Extending forward, really pushing yourself forward and curling the spine when you go backwards. Continuing for a few more rounds. Ensuring you're opening the chest when you come forward and curling the spine when you go backwards. Remembering to breathe. Coming still, and we then reverse in the other direction. These are extended Sufi grinds. Keeping the base nice and still, and rotating the spine around the base of your body. Continuing to breathe in and out. Coming still, we move on to the second exercise, which is the Sufi grind, but with smaller rotations, making the movement a little bit faster. Still breathing in as you move forward and exhaling as you move backwards. Come still, and we reverse in the opposite direction. Continuing to breathe. We come still. And then we reverse again in the opposite direction. For one last time, breathing in and out with these small circular motions of the spine, extending the rib cage as we come forward and to the side, curling the back as we move backwards. And we stay in the sitting position, ready for our pelvic tilts. Tilting forward and backwards, just from the pelvis. Breathing in and out. For ease, keep your hands on your knees. Coming still, and now we repeat the same exercise but at a much slower pace, as though you're moving in slow motion, tilting back and forth, breathing in and out. Really feel every part of the motion. Continuing slowly for a little more time. Helping to unlock the hips and those emotions that are trapped in there. Come still. Breathe in through the nose, out through the mouth. Moving to the next position of lying flat on your back, placing your palms facing the floor, and we tick-tock our feet. The movement should start from the hips, as though the bone is rattling around in your hips. Tick-tock, tick-tock, tick-tock. Continuing to breathe in through the nose, out through the mouth, tick-tocking legs, shifting from the hips. Keep going. Not long now. And we come still. Now bring the legs in to a butterfly position so that your knees are apart and your feet are touching. Lift your knees a couple of inches. Stay there. Allow them to stay raised. Hold the position, breathing in through the nose, out through the mouth. And release. Bringing them up again, this time an inch or two closer than before. So your knees are floating with your feet still touching one another. When you hold this position, you may find that your knees start to shake or your legs start to shake. This is quite normal. Just stay with it and continue to breathe. Bring the knees down. And then bring the legs back up again. And this time a little bit closer. You're bringing the knees just a few inches closer together. You may feel the shaking sensation. This is some unlocking of emotions and energies, so just allow it to happen. Continuing to breathe. And bring the legs back down again. One more time. Bring the knees closer together. An inch or so more than you did before. Allow them to hover. As you can see, my knees shake a lot and my legs shake a lot with the unlocking of these emotions, and this is normal. However, if you don't experience this, that's also fine. Hold the position and now let it go. Take a couple of breaths in through the nose, out through the mouth. Bring your legs up. Just allow you to rest, really. And we move on to the next position where your knees are together. And this time we bring the knees apart, just a couple of inches. Feet are together, flat on the floor. Allow your knees to come apart a couple of inches and hold that position. Remembering to breathe. Bring the knees back in together. And again, bring them apart, maybe an inch or two further than before. Hold the position, breathe, always in through the nose, out through the mouth. Again, you may find some trembling or shaking starts to happen, and that's okay. Just allow it to be there. Bring your knees back in together. Again, allow them to come apart, and this time a few inches further than the last. Hold that position. Allow for whatever comes through to come through. Sometimes there can be some release of emotion, and often not. We're not looking for that. The changes are often very, very subtle. Just allow it to flow, keeping that position. Bringing the knees back together. And then for the last time, allow them to come apart a little bit further than before. Hold the position. Breathe. And bring the knees back together. We then move to our next exercise. Laying one leg out flat, the other one will be raised. And you see the kicking action that we start to do. When we kick, you jolt the foot at the end, so it's really coming from the hip. Kick, 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 kick. Remember to breathe. Kick. Bring that leg down, foot on the floor. And now we do the same on the opposite side. Kick. Remembering full force at the end so that the foot, the heel jolts. Kick. 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 Bringing the foot down, resting for a moment. The next exercise will be the exact same movement but in slow motion. However, when you get to the end of the kick, again, you give it your full force, as though I'm leaning against you with a pillow and you're pushing me away. You can have the stationary leg bent, as I have in the video, or you can place it flat against the floor, whichever suits you. We move on to the other leg. Kick, slowly pull back, slow motion forward, and jolt at the end. The movement is mindful and with intention. Remembering to exhale when the foot is extended. Come still. Allow yourself to rest. We've come to the end of our somatic exercise for suppression.